everyone, welcome to Flexibility Script. This video we're covering today is going to be going over how to use a floss compression band for doing a knee mobilization. Now for the floss compression, it's also known as a Voodoo floss. For the knee joint itself, it can be really helpful when we're dealing with swelling and inflammation. If there's ever any tweaks or pains or issues going on with the knee, it's usually my go-to for taking care of it, as it gets right into addressing things going on right at the joint. The floss compression band can also be used to release tension in the muscles, very similar to self-myofascial release techniques that can be done like with things like foam rollers. So if I wanted to release tension in my quads, I can also use the floss compression band in the same manner that I'm going to wrap it for my knee, use it on my quad to release the tension in my quad. But for the knee joint, it is can be a really big lifesaver for many. So what I'm going to be doing is I usually just go into addressing the area to be wrapped, which is the knee itself, and I usually start right at the very top of the tibia, which is the tibia is like your shin bone here, and the wrapping will just encompass the knee itself. When I do this, I usually, if there is swelling going on, I kind of pinpoint the area where their swelling is, and that's where I'm going to put the tension of the band. So when I wrap, there's this 50 to 75% tension that I'm putting over the area that I want to address. So when it comes to the knee, if there's inflammation and swelling on the medial side, or if that's where I'm having pain, that's where the tension is going to go on. If I'm having issues if I'm having issues right above the knee, I'm going to stand. If I'm having some issues right above at the top and there's inflammation above, I'll maybe start the wrap a little bit higher. Therefore, I'll be able to cover the tension right above the knee. And same likewise, if I have issues happening on the lateral part of the knee, that more of my stretch tension, the stretch tension will go into that area. So for right now, I'm just going to pretend like the inflammation, that's Clover. I'm going to pretend that the issue is happening just generally everywhere in the knee joint itself. So the stretch tension is actually going to encompass a bit of everything. So main thing to think of when you're wrapping is that you want a 50% overlay. So you're looking to wrap about half of what you put down every time you wrap. That way it's not like stacked right on top of the other. The other thing to keep in mind is that you want that stretch tension, that 50 to 75% to be going over that area that you're wanting to address, whether it's in the musculature or the swelling in the joint. As I do this, once it's on, my main thing is to floss, which floss is just simply meaning movement. So as soon as the band is on, I want to get my knee through some range of motion, and it could be as simple as laying on my back and just little bending and straightening of the knee, or I could just stay on the ground and be doing that. It's just very small movement, especially you don't want to grab it through a lot of range of motion, because the back of the knee will also have the wrap on it, and it can make it hard to bend and straighten the leg once the compression is on. So to get started, I'm going to be coming right underneath, like I mentioned, right at the start of the tibia here. I'm going to pin, stretch, wrap is the technique to be used. So can you catch me okay without Clover? Yeah? Okay. Alright, so I'm going to pin. Once I pin, I'm going to stretch, and then once I stretch, I'm wrapping right over, so getting that very top of the tibia. From there, there's hardly any tension on that back part as I bring it around. And then again, I'm going to pin, stretch, wrap, and then come under. And my knee, as I wrap, I kind of keep a little soft bend to it. So again, I pin, stretch, wrap. And I kind of practice some caution as I'm going over the kneecap, because I want to make sure I always pin it and I'm always stretching, and then I'm laying right over it. That I'm never putting that pin, and that as I stretch that I'm moving over the patella itself. The patella is the kneecap, because sometimes if I do that, I kind of end up shifting my kneecap out of alignment. So again, I pin, stretch, wrap, come under, pin, stretch, wrap, and I'm using Rubberbanditz Floss Compression Band, pin, stretch, wrap, come under, pin, stretch, wrap. By this time I've already passed knee joint. Notice that there's like a 50% overlay. Again, pin, stretch, wrap, and then I'm just going to find somewhere there's this little extra bit that I want to tie off somewhere else, and then from here I'm just going to find a little end, and I'm going to tuck it through, and there's that tuck through, and then I'm good. From here, all I need to do, once that Voodoo Floss Compression Band is on, all I need to do is take my leg through some movement. So the movement, like I said, could be really simple, bending and straightening. I'm going to take my leg, and if you have a foam roller or maybe some books or a couple of pillows that you can pop your leg on, you can go into bending and straightening the knee. I'm going to turn here, so I can pop my leg on here, and then from here I'm just focused on going through some contraction of the quad and then relax. Contract the quad and relax. And I'll continue there, going bending and straightening for 1 or 2 minutes. Sometimes when I'm dealing with knee issues, if I could get some space within the knee joint itself as I'm doing this contract and relax, it could bring a bit of pain relief to the area if there's a bone-on-bone issue along with the inflammation and swelling. To do that, you're going to take a band. I have a Rubberbanditz band here. This band has about 30 to 50 pounds of tension. I believe it's their medium band. And then I have a door anchor here. Now this door anchor, I can just take this door anchor and then loop it through the band. And then that way it's anchored to the band, and then that little end here is going to go through a door, and that way I have somewhere to anchor the band to for this. So I'm just going to come right over. I'm going to work my way through. And I'm going to anchor the band. You go into a door right at the door hinge area, and I pop that thick end through. So once it's in, I close the door, and then it'll anchor the band in, and then I'm secure. And I have it set a little low. Now from here, I'm just going to come back out, and I'm going to take my foot, and I'm going to place it in, and then cross, cross. And now from here, I can take that roller, and then I'm just going to come back to some tension. When I come back to some tension, it creates some space at the ankle, at the knee joint, and also at my hip. And I just want a little bit of tension, enough to where I feel the band is pulling me, but I'm in control. And I'll continue doing that bending and straightening of the knee. So again, floss, compress, and then add a tension with the band to the leg. That way there's a separation in space, so that band just creates this distraction, which just means creating space. And we want that at the knee joint, especially if something's happened injury-wise and you've landed and there's some of that happening. I'm at a loss for words. Some compression happening at the knee joint, and just wanting to create space between the knee and that meniscus and any inflammation or swelling that could be present there. So kind of doing a lot in a little. And again, just continuing to contract my quad and relax it. Contracting the quad helps to line that knee up into a better place, and then that compression is helping to get rid of swelling and inflammation in the area. And the way it does that, that compression is really high. That 50 to 75% that we put on the knee joint is high enough to where it kind of forces a lot of the swelling out, making your lymphatic system kind of work to uptake that extra fluid, so that when we're done, I'm going to come off release that tension so that we're done. We end up getting this rush of blood flow to the area. To undo the band, I'm just going to find that end point where I hooked it and then just remove it all the way. Now, when you remove it all the way, let's say you've done it on just regular skin, you'll notice that there's these little stripes on your skin, all normal. As blood flow and stuff goes back, those stripes that you see will disappear, and you'll also be able to see swelling go down, as well as a bit more definition in the patella and the musculature, especially if you were seeing swelling before. You should see it start looking a lot more normal then. There's a little bit more to it than this. There's an addition that we can add to work with our tibia for knee tracking issues, and hey Clover, and so it'll be a future video where I'll get into that, along with what can be done with some rock tape to help the knee itself. But for now, give it a try if you're dealing with knee issues. Bye!